Welcome to the fourth of 6 podcasts in the series Helping Patients and Caregivers Take the Next Step in Care, Medication Management. In this podcast, Monitoring Medication Compliance, CMS NSICV 2011-D, Susie Butler and Carol Levine will explain the importance of monitoring medication compliance for patients who transition from one care setting to another. This podcast is produced as a partnership between CMS and the United Hospital Fund's Next Step in Care campaign.
Monitoring compliance with doctor's orders can be difficult, especially for caregivers who don't live with the person they're helping. Simply put, medicine doesn't do you any good if you don't take it.
According to the National Network for Health Innovation, approximately 187 million Americans take one or more prescription drugs. Up to half the people who take prescription drugs do not take the medications as prescribed. Not taking medications as prescribed costs more than $100 billion each year in excess hospitalizations.
What are some of the telltale signs of a problem? If you always run out before the prescription can be refilled, or if you have too many pills left at the end of the month, something may be wrong. Dr. Lazarus has some suggestions.
When people become non-compliant with medicines, one of two things happens. Either they get worse. Their blood pressure may go up, their sugars may go up, they may get more confused, more tired, or the opposite occurs. They may get better, they may stay the same. I think when someone stops medicine and we see a change one way or the other, we need to assess what's going on. We could often tell which medicine stopped. For instance, someone may be on a blood pressure medicine and now their blood pressure is much higher. So we know they're probably not taking the medicine. On the other hand, that might lead to positive results. They may be more energetic, may not fall as much. And then we have to look at ourselves and say, well, did they really need that medicine? Some of the biggest changes in medicines I've made are because of non-compliance of patients. But usually, because each medicine should have a purpose, we usually could figure out if they're not taking the medicine if we're monitoring for those particular things.
Once you notice a problem, don't jump to conclusions about what's wrong until you talk to the person you care for.
And you can't just ask the patients whether they're taking their drugs or not. They may answer yes, but the question is, are they taking their medications as prescribed? Or are they taking it every other day? Or are they taking twice as much because they're in more pain? So those are all questions that you have to ask to really find out how they're taking their medications.
There are lots of reasons why someone might not take their medication as prescribed. One of the biggest barriers can be the cost of the medication. In our next unit, we'll focus on ways to find help paying for prescription drugs.
There are other reasons for non-compliance that have very practical solutions.
My dad doesn't like to admit it, but it's really hard for him to get to the pharmacy.
Get the person a ride to the pharmacy. Pick up the prescription for them. Find a pharmacy that delivers, or investigate mail-order pharmacies.
My wife has trouble getting the pill bottle open.
Talk to your pharmacist.
My dad doesn't like to take anything if the product information isn't in Korean.
Talk to your pharmacist.
My son really hates the taste and has trouble swallowing these.
Talk to a speech therapist about persistent swallowing problems. Talk to your doctor or pharmacist about more palatable alternatives.
There are other common reasons too. You may not understand the reason for the medication. You may not think the medication is needed. You don't like the side effects. You know someone who had a bad reaction to a particular drug. Someone might prefer natural substances or simply forget to take medications. Some people share drugs with others, and sometimes there are cultural or religious practices, such as fasting on religious holidays. Dealing with these reasons may require a combination of education and persuasion by knowledgeable caregivers, physicians, or pharmacists.
Pharmacists are available all over the country. They're the most accessible healthcare provider out there, and for the most part, pharmacists are more than willing to talk to every single patient that asks for help. So I recommend that you go find your local neighborhood pharmacy and talk to them.
If you are a family caregiver who is responsible for medication management, here are some tips.
Make sure that you know why the doctor wants the person you care for to take the drug, and that the doctor knows why the patient is not taking the medication as prescribed.
If the person you help is worried about side effects, you can help them monitor the symptoms.
You can also simplify things by asking the pharmacy to call or email you when you need to order a refill.
Do you know how many people who take prescription drugs do not take their medications as prescribed? What are some reasons for noncompliance that may have practical solutions? What are some reasons for noncompliance that may require education or persuasion? Thank you for listening to this CMS podcast. You may also be interested in the other podcasts in the Next Step in Care series: Medication Risks During Transitions in Care, Medication Reconciliation, Monitoring Compliance, Help with Medication Costs, and Caregivers and Medication Management. The information you heard was correct as of the date it was recorded, July 28, 2011. This podcast isn't a legal document. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings. Thanks for listening.